Well, the Jaguars may not have made it into the postseason, but that doesn't mean they're not preparing for next season.
Yeah, because as our next guest knows all too well, conditioning and training is really a year-long job. Dr. Kevin Kaplan is with the Jacksonville Orthopedic Institute, and he is the Jaguars team physician. So welcome back, Dr. Kaplan.
Thanks for having me back, guys.
So slower for you.
A little bit. Back to some regular practice, you know.
Good, good. So what are your responsibilities as the team physician for the Jaguars through your role at JOI?
Well, you know, unfortunately, as we all know, football is it's a rough sport, and injuries are just inevitable. So on a week in and week out basis, I'm seeing injuries. You know, I'm there with them during the game, obviously, and then during the week, I'm there at the stadium about 3 times a week, evaluating the players, looking at their injuries, and trying to treat their injuries to get them back as safely and effectively as possible.
And is that what you're doing now with the team? I mean, obviously, I don't think that they're holding practices or anything. I mean, you know, the season is over. So what is your role today?
So now, I mean, guys have had surgeries towards the end of the year, even during the year, and so we're still evaluating them, trying to treat their injuries, because before we know it, training camp will be here, organized training activities will be here, so we need to treat those guys to get them ready, because the next season is you know, right around the corner.
Yeah, and it's really important to, you know, professional athletes and even, you know, weekend warriors to make sure that their recovery time is as small as possible, because we all have lives to lead. So talk about this new knee procedure that you guys are doing.
So arthroscopy has developed over the course of many years. It started in the 1970s and 80s, where people made 3 to 4 tiny incisions around the knee to go in the knee and deal with cartilage injuries, ACL tears, and things like that. In the 80s and 90s, they went to 2 incisions, and now there's a newer technique that I've been performing here in Jacksonville called SPA, which is a single portal arthroscopy. So I can make 1 tiny incision and go in through that 1 incision with my camera and instruments, and the recovery is quicker. The pain is about 20% less in a lot of the studies. So if I could, you know, if I told you with a meniscus tear I could get you back quicker with less pain, it's something that you'd definitely be interested in.
Well, and you mentioned, you know, just random people at home trying to get exercise, and, you know, the weekend warriors you said a moment ago, and there's a lot of people who are watching, obviously not on the Jaguar roster, who are going out and exercising with 2015. I mean, there's a lot of New Year's resolutions for people to get up and get active, and if they're like me, they want it overnight. So they're going out and they're trying to run a marathon in the first week of this New Year's resolution. And I actually have a couple of friends who said, this is the year they're going to do CrossFit. And I mean, jumping into this stuff really quickly, I mean, I'm sure you see a lot of people coming into your practice saying, gosh, I wish I hadn't done that like that. Maybe I should have slowed it down a little. It's
the most common thing we see at the beginning of the year. It's people that say, hey, I haven't exercised for 6 months, I'm going to get into it, and everybody's doing CrossFit, so I'll get into CrossFit. You know, is it safe? And the truth of the matter is, it's a very safe exercise. Technique is very important, but it's something that you should really build up to. You need to get with someone that knows the techniques, that knows how to properly instruct you, and not try to get to the finish line in the month of January. Right? You got to do it over the course of 4 to 6 months, even a year of getting your body reconditioned.
There could be some serious injuries associated with that. Have you seen people coming into your office with those kind of problems?
Yeah, a lot of them are overuse injuries, whether it be rotator cuff tendonitis or a knee strain. Occasionally you'll get the meniscus tear or the rotator cuff tear, and those things happen whether or not it's just CrossFit or regular exercise. So
you're out for a while, right?
Yeah.
What's that?
You're out for a while.
Yeah, you can be. If you need surgery, if you need a rotator cuff repair, then that does put you back. So in the time that you could, you know, slowly get into it rather than trying to hit the ground too fast and then injure yourself and be out for another 6 months.
So we'd like to prevent injury. So what's some, you know, practical advice that you can give us for, you know, trying to be more active in the new year, but maybe not overdoing it?
Well, getting into a basic stretching program, a basic strengthening program without the complex movements of a CrossFit at the beginning. So working your way in, not trying to do it 7 days a week, maybe 3 times a week, and then conditioning other days of the week, and even getting into things like yoga, Pilates. Those are fantastic exercises that help to strengthen and lengthen the muscles and tendons, getting them ready to move forward with more complex activities.
Very cool.
All right, well, thank you so much. We appreciate you as always, and hope you're enjoying a little bit of the downtime before the season ramps up again, but we appreciate your perspective as always, and thanks to Jacksonville Orthopedic Institute for sponsoring this segment. And for more information and to find an office near you, you can visit joi.net, or you can call them. The number is there on your screen, 904-346-3465.